I got up at 4:30 in the morning like I normally do. Felt fine, no problems whatsoever. And next thing I know, I lost control of my eyes. One was looking one way, one was looking the other. The right side of my face was starting to droop.
Heart rate's 85, blood pressure right now is 170/85.
I think you're having a stroke, and it's caused by blood clot.
So I went for a CAT scan. When I come back, they had pulled Dr. Barreto up on the TV screen.
Can you tell me about your past medical history? Do you have any medical problems?
I've had high blood pressure most of my life since I was a teenager. I'm currently on Benacar.
We use specialists on call. We get a neurologist, and the neurologist examines the patient. He can talk to the patient.
Can you tell me what happened this morning? What brought you into the emergency room?
I was at work and I started getting blurred vision.
Specialists on Call is a service company, technically in the telemedicine space, but we're not about the equipment, we're about the doctors. And what we're doing is distributing the services of excellent physicians to community facilities that normally wouldn't get them.
It's hard to imagine a doctor being at your bedside on a TV screen and treating you, but he did it.
Open up your eyes very big. Can you look straight up?
It's telemedicine that allows us to increase the likelihood that we'll have a life-changing impact on our patients.
Hello, my name's Dr. Lynn. I'm a neurologist with Specialists on Call, and I understand you're not feeling well today.
We move state-of-the-art care to the patient's bedside at the time they need it. We reduce the cost of that care over any traditional delivery model, and we offer an employment opportunity for our physicians that's well paid and quite satisfying. So it's truly a win-win, particularly when you add on the fact that patients are receiving better care.
How about the other arm? Can you lift that up and hold it for 10 seconds? 8, 9, 10. It looks like you're having more trouble on the left. Would you agree?
Yes, sir.
Part of the thing for stroke is a neurologist needs to see the patient within 15 to 20 minutes.
From the moment I started talking to Dr. Barreto, I really wasn't scared anymore.
Now there's a medicine we can give you that breaks up blood clots. It's called TPA, and it's a clot-busting drug.
TPA is a drug that can be given to patients with severe stroke symptoms, but it must be given within a short period of time.
After you get the medicine, we're going to be monitoring you very closely, and you'll be admitted to the ICU.
Yes, sir.
The beauty of telemedicine is that I can do everything with telemedicine that I would do at the bedside. I can talk to the patient, I can talk to their families, I can talk to the staff, and it really creates that personal experience. It's really the most efficient and effective way to practice medicine that I can think of.
What I'd like you to do is hold both your arms out with your palms up in front of you.
Specialists on Call benefits everybody. For the hospitals, they get immediate access to the specialists that they require. The patients get the care that they need very quickly, and the local physicians are relieved of the burden of having to take call.
I'm working with Specialists on Call for last few years. It is extremely beneficial. In the event of stroke, I don't have to rush to the hospital when I'm busy in my practice. We have not had any single problem, and the paperwork and the triage is completely thorough, and level of satisfaction is extremely high in terms of the standard of care and the quality of life for the neurologist.
Once our physicians are connected via telepresence to the hospital, they're examining the patient, they're talking with the ED staff, they're talking with the patient's family, and they're providing the highest level of consultation as if they're standing right next to the bed. In addition, our physicians have immediate access to the CT scans for that patient. We're using our own electronic medical record to provide a consultative report that is as complete as if the physician were standing right there with them.
We work with the local ED physicians. We practice only evidence-based medicine, and we make recommendations regarding any neurologic emergency.
Now what I'd like you to do is open and close your hands rapidly, like this.
Specialists on Call is different because we focus on the medicine of telemedicine. We've gathered together an exceptional group of board-certified, fellowship-trained neurologists that we connect across the country via telemedicine. We're also a Joint Commission-accredited organization. We also boast incredible clinical quality, and nobody's come close to our track record.
Specialists on Call tele-neurology service is not only reliable, but it's easy to use, and we can install it with no interruption in a hospital's daily workflow or on their network. In addition, we provide 24/7 support for our service.
Mr. Smith, I'm happy to tell you that your exam is normal neurologically.
Thank you, Doctor. That's great news.
This is an incredibly satisfying way to practice medicine. I work with an exceptional team of board-certified fellowship-trained neurologists. It's a great feeling to do what you love and make a significant difference in patients' lives.
As far as I'm concerned, saved my life.